This is the glenohumeral joint. It's the most mobile joint in your body, but that mobility comes at a cost of stability. Meet the scapula and clavicle. This bony connection is the only bridge attaching your arm to your main skeleton. The subacromial space. This tiny tunnel is where all the traffic flows. If this space narrows, pain begins. The Acromion process. This bony roof hangs over the joint. Its shape determines how much room your tendons have to move. The bursa sac. Think of this as a fluid-filled balloon that acts as a cushion between the hard bone and soft tendon. The rotator cuff. 4 small muscles that grab the head of the arm bone, keeping it centered in the socket. Beneath the big deltoid muscle lies the real machinery. The rotator cuff does the fine-tuning of every movement. The wiring system. Nerves from your neck pass right under the collarbone. Compression here causes numbness in the arm. In a healthy shoulder, abduction is smooth. The arm bone rotates, clearing the acromion bone without any contact. Scapulohumeral rhythm. For every degree your arm moves up, your shoulder blade must rotate to accommodate it. Watch the clearance. See how the supraspinatus tendon slides underneath the bone perfectly? This is how it should work. External rotation. This movement clears the greater tuberosity from hitting the acromion, preventing impingement. Reaching overhead. The clavicle raises and rotates, creating just enough room for the tendons to pass safely. Internal rotation. The subscapularis muscle creates a powerful inward pull, essential for daily tasks like reaching behind your back. The bursa in action. It changes shape and glides, ensuring zero friction between the moving layers of your anatomy. The serratus anterior. This hidden muscle locks the shoulder blade to the ribs, providing a stable base for the arm. Circumduction. The shoulder allows 360-degree movement, a feat of engineering that no other joint can match. Resting position. Even when doing nothing, gravity pulls on the arm and the capsule holds it in suspension. Bursitis. The bursa sac becomes inflamed and swollen from constant friction, filling the already tight space. Bone spurs. Over time, the bone grows a sharp edge. This spur acts like a saw, cutting into the soft tendon. The pain arc. Notice how the pain only happens in the middle range of motion. This is the impingement zone. Scapulodiskinesis. If the shoulder blade doesn't rotate, the arm bone crashes into it. Mechanics have failed. Tight chest. Short pectoral muscles pull the shoulder forward, permanently narrowing the tunnel for the tendons. High-riding humerus. If the rotator cuff is weak, the big deltoid pulls the arm bone up, smashing it into the roof. Friction burn. Constant overhead motion creates heat and micro-trauma, turning the white tendon into a red, angry tissue. Cavitation. Sometimes it's just gas bubbles bursting in the joint fluid. This pop is usually painless and harmless. Crepitus. That grinding sandpaper noise? It's often scar tissue rubbing against rough bone surfaces. Loose ligaments. If the joint is too loose, the bones shift slightly, clicking as they slide back into place. Snapping scapula. The clicking isn't the joint, it's the shoulder blade rubbing against the ribs due to lack of cushioning. Calcium deposits. Hard stones form inside the tendon. When they hit the bone, you hear and feel a click. Arthritis grinding. The smooth cartilage is worn away. Now raw bone rubs against raw bone. Muscle knots. A tight trigger point can cause a muscle to jerk, snapping the tendon tight and creating a noise. Upright rows. This movement forces the shoulder into internal rotation while lifting, a guaranteed recipe for impingement. The flared bench press. Elbows at 90 degrees crush the rotator cuff. It's the most common gym injury. Behind the neck press. This puts the shoulder in an extreme, vulnerable position, stretching the ligaments dangerously. Side sleeping. Sleeping directly on the shoulder joint cuts off blood supply and compresses the inflamed tendons all night. Text neck posture. Rounding your shoulders forward closes the subacromial space before you even start moving. The empty can. Lifting with thumbs down rotates the shoulder so the bone hits the tendon directly. Avoid this. Backpack compression. Heavy straps press down on the clavicle, narrowing the nerve pathways and the joint space. Computer posture. Reaching for a mouse keeps the trapezius under constant tension, elevating the shoulder unnaturally. Deep dips. Going too low in a dip forces the head of the humerus forward, straining the front capsule. Retraction. Squeezing the shoulder blades back creates a stable platform and naturally opens the chest. External rotation. Strengthening the infraspinatus prevents the arm from rolling forward into the impingement zone. Wall slides. This teaches the serratus anterior to rotate the scapula upward, clearing the path for the arm bone. Thoracic mobility. If your upper back is stiff, your shoulder has to work twice as hard. Mobilize the spine first. Chest stretch. Loosening the tight pecs allows the shoulder to sit back in its neutral, healthy position. The Y raise. This targets the lower traps, the forgotten muscle that pulls the shoulder blade down and back. Elbow tuck. On the bench press, tucking elbows to 45 degrees protects the shoulder while still building the chest. Isometrics. Strengthening the muscle without moving the joint is the safest way to start rehab for a painful shoulder. Cortisone shot. The needle delivers strong anti-inflammatory medicine directly into the bursa to stop the swelling cycle. Fibrosis. When micro tears heal, they form disorganized scar tissue. It's strong but less flexible than the original tendon. Acromioplasty. In surgery, the doctor shaves off the bone spur, physically widening the tunnel for the tendon. Tear types. A partial tear is like a frayed rope. A full tear is when the rope snaps off the bone completely. Frozen shoulder. The capsule shrinks and tightens like shrink wrap, making movement impossible and painful. Blood flow. Tendons have poor blood supply. Rehab exercises pump fresh blood into the area to accelerate healing. The kinetic chain. Power comes from the hips. If hips are weak, the shoulder takes extra stress to compensate. Acromion shapes. Some people are born with a hooked acromion bone, making them genetically prone to impingement. Hypermobility. Double-jointed shoulders are unstable. They need strength, not stretching, to stay healthy. The goal. A perfectly aligned, pain-free shoulder where bones, muscles, and tendons move in a silent, smooth symphony.